Continues now with information on alternative methods to treat depression entering the medical community's mainstream. Joining us is author, psychiatrist, and psychopharmacologist, Dr. Julie Holland. Welcome, doctor. Thanks for coming.
Thanks for having me.
So many questions.
Yes, I have lots of questions. This is an interesting topic. There are plenty of information, things online about psychedelics, but what's about the resurgence? What brought this about? How long has it been going on?
It's definitely trending, right? I mean, there's just a New York Times article a couple days ago. It's very popular. And really the question is whether you should be taking it seriously or not, right? Not knowing how seriously to take these things. So, I guess, you know, when we think about psychedelics, we might think about the 60s and the hippies, and then maybe we want to discount that. But the truth is that the hippies were right about quite a few things. The whole anti-inflammatory idea of yoga and meditation, or fermented foods, kombucha, things like that, those were all the hippies' ideas, and they were actually absolutely right. Those things are better for your physical and mental health. So with psychedelics, there's been about at least 20 years of pretty serious, rigorous, double-blind, placebo-controlled clinical trials looking at using psychedelics to treat depression, anxiety, post-traumatic stress disorder. Turns out there's really a lot of convincing data there.
So question, at what point is this a path someone should consider? Because you have therapy, you have breathing technique, there's all those sorts of things. At what point should you look at this under the guidance of a doctor?
Well, if the currently accepted treatments aren't really working for you, if you've tried antidepressants, if you tried psychotherapy, if you've tried psychotherapy with antidepressants, maybe you've tried several meds, if those things aren't working for you, you can start to look at alternative therapies and see what else might be appropriate. And these are considered breakthrough therapies. The Food and Drug Administration has designated psilocybin and MDMA as breakthrough therapies for psychiatric treatments for depression.
And what other alternatives are there if you don't want to use any kind of drugs?
Well, one thing people really overlook is phototherapy, which is actually using light therapy to treat depression. And that works very well for seasonal depressions, so sort of like the winter blues that people get.
Oh, like they say have more sunlight and everything?
Yeah, and vitamin D can be very helpful, but also just good psychotherapy, whether it's individual therapy or with your family or group therapy. All those things can help if you don't want to take medicines or you don't want to try these alternative therapies.
And how do the alternative therapies actually work when you compare them to other medical prescriptions?
Yeah, I mean, it's very different, right? With the antidepressants, you're sort of treating the symptoms, you're not really treating the cause. And with psychedelic-assisted therapy, you're really getting to root causes. You're looking at trauma, you're processing trauma. You're also maybe finding more meaning in your life. If you're having existential despair, I think the psychedelics can really be meaning makers. And then you have this issue of neuroplasticity, right? Which is the brain being sort of more plastic, more flexible. I mean, a lot of depression and anxiety or OCD, it's about this sort of rigidity, this cognitive rigidity that you're convinced that this is the way it is, you know, or even with addiction, you know, if I have this drink, I'm going to feel better, or with anorexia, like I can never be thin enough. You're rigid in your thinking. And the psychedelics introduce a sort of cognitive flexibility.
They loosen you up a little.
What if I'm wrong? But they also introduce that flexibility really in the brain. And people talk about neuroplasticity in terms of like rewiring the circuitry. You know, it's not exactly that, but it's a good metaphor that you can sort of do some end arounds and change the way the brain works and the way your thinking works. It changes your perceptions, your cognitions. Now, this is a short-term session that happens with a therapist usually. And there's a lot of preparation before and there's a lot of integration after. So this is not something you do as a take-home. It's very supervised.
All right, let's get a break. We'll come back more with Dr. Julie Holland right after this.